Okay. Yes. Today we are going to deal with a topic that we introduced last time: substance medication-induced depressive disorder. Substance or medication-induced depressive disorder. And as per what we talk about, we usually introduce what we are talking about: substance and medication. Those are things that are introduced to our body to help. Others are introduced not to help. What are these substances? What are these substances that are introduced to our body that may help us or may not help us, but may still make us go to depression or have some issues? What are these substances? Now, let's introduce our topic today. Our topic today is medication induced depressive disorders. And what is this topic talking about? It's a type of this depressive disorder that occurs due to physiological effect of a substance, including drugs of abuse, medication, or toxins. This condition is classified under the depressive disorders. If you look in the DSM-5 that we talked about, they are characterized there. You will see and follow up and see how they are characterized and how they follow each other. So, definition of this. What is the definition? Substance-induced depressive disorder is characterized by prominent depressive symptoms. Prominent depressive symptoms. Which are these symptoms? The first symptom is always sadness. Sadness, sometimes loss of interest and hopelessness when you are having depression due to substances. The other thing is direct caused by the use of withdrawal from substances of medication. When someone is uh, undergoing withdrawals, yes, or you have been using some substances and now you want to come out of them, hmm? Directly caused by the use of or withdrawals from the substances. Symptoms are not better explained by independent depressive disorder. You get it? Symptoms are not better explained by an independent depressive disorder. So let's check what are these substances, medication of addiction or substances that may help. Refers to drugs or chemicals that cause physical or psychological dependence, leading to compulsive use of harmful consequences. These substances can affect the brain's reward system, especially by increasing dopamine levels. You get it? When you increase dopamine levels, you know what happens. Now, main categories of these substances. What are the main categories? They are those that act in your CNS, central nervous system, your brain. Those that act in your brain, like alcohol, they depress the brain. Alcohol depresses the brain. It slows the brain by inhibiting some the neuron system. Yes, you get it. It inhibits the system that makes you coordinate. Alcohol. And you see, when you withdraw, you get tremors, seizures, delirium, and yes, tremors. Now, there are some things like we are talking about drugs that work in the central nervous system. We have benzodiazepines. Benzodiazepines. First, it was alcohol. The other one is benzodiazepines. The other one is barbiturate. These ones, they depress the central nervous system. They make your central nervous system to work slow, your brain to work slow. There are some people who go to hospitals because of stress and some other issues. They are given diazepam and losartans, antidepressants, and they get used to them. This may make you be depressed. It may cause depression. Some drugs are not better to overuse. So benzodiazepines like the diazepam and losartan. That's why I usually say these drugs are not over-the-counter drugs. These are drugs that are supposed to be sold under a prescription of a licensed under a prescription of a licensed medical doctor. Yes, yes, or medical practitioner. Now, there are some others that are called barbiturates. Barbiturates are less commonly used due to high overdose risk. Barbiturates, yes, those ones are less commonly used. So we've seen the substances that we are talking about that depress the central nervous system. One is alcohol, the other one is benzodiazepines like diazepam, the other one is barbiturates. Barbiturates. Okay. Let's see the ones that stimulate the central nervous system. Stimulants. Stimulants. They overdo some 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 neurotransmitters. They overdo. You see, like CNS stimulants, cocaine. Cocaine, it blocks the reuptake, the reabsorption. So the dopamine piles up. It becomes high. So in your brain, when you take cocaine and it goes to your blood, to your brain, it blocks the neurons or the system of taking and balancing dopamine. So dopamine piles up and it becomes a bad thing. Instead of being the normal level, it becomes a bad thing. So what happens? You start having intense euphoria, followed by crash. You lose yourself. You lose. That's why people that do more cocaine, you may find them in the streets unconscious. So when they are unconscious, they are taken to the hospital, and the level of cocaine in their body is brought down. And if it is high enough, sometimes they even go for dialysis so that they can reduce more cocaine to stop blocking dopamine to be taken up so that it avoids piling. You see? So the stimulants even are not better. We have amphetamine, methylamphetamine. Yes, amphetamine. Amphetamine. What does amphetamine do? Increase dopamine and norepinephrine. Amphetamine. So when dopamine and norepinephrine is increased, what happens? Someone becomes stimulated. You are high. You talk every time. You run around. You jump around. You do things that normal person cannot do. But you may crash. You may get a coma. Used medically for ADHD narcolepsy. Yes, those are situations that they are used for. High abuse potential. Yes, the amphetamines are really highly abused, and that's why they are not over the counter. Caffeine and nicotine. Caffeine and nicotine addiction. You get it? When you are down and you feel asleep and you don't want to feel asleep, what do? You take caffeine. That's why some people are really addicted to coffee. When they take coffee, it blocks the neuron system, dopamine piles up, eh, your epinephrine piles up, and then what do you start feeling? You start feeling high. Yes, you are okay. You feel the sleep that you are having is not there again. You see that? Now we continue to opioids. We started by we are going through the the substances. We are going through the substances. The first substance was that depressed the central nervous system. We talked about alcohol. We went to benzodiazepines, and then we went to barbiturates. Now, the other one is stimulants. The other category is stimulants. We talked about cocaine, and then we went to amphetamines. Yes, after amphetamines, we went to caffeine. These are the substances people abuse a lot, and they may be toxic. They may be toxic. The third one here we talk about is opioids, narcotics. Opioids, narcotics, heroin, morphine, codeine, fentanyl, oxycodone. People use oxycodone at times to relieve pain. Yes, the oxycodone is highly used to relieve pain, but the problem is of oxycodone is addiction. Acton alpha opioid receptor. So they make the receptors to they block. So the neurotransmitters go high, and when neurotransmitters go high, what happens? What happens is you may start being high. High. Those are the substances that we see. Now we have hallucinogens. Sometimes you may take some drugs and then you start to hallucinate. You may take some drugs and then you start to hallucinate. The hallucinogens, you start hallucinating. Like ketamine. Ketamine, you see, it works on pain, but it is anesthetic. It is used to numb a place so that you can go undergo a medical procedure. But when pain is so much, sometimes they use ketamine to relieve the pain. So don't use ketamine thinking you are relieving the pain. You may become addicted and start hallucinating. So hallucinogens, we have ketamine and marijuana. Marijuana is a drug of hallucinating. Acts on cannabinoid receptor. You have receptors in your brain called cannabinoids. So when you smoke marijuana, people like those that smoke marijuana, you may find the people that smoke marijuana, they hey, I'm Avon. Yes. Hi. We are talking about drugs of substance and substance abuse. Yes. Yeah, these people that smoke marijuana, these people, you will see them talking very slowly, and sometimes their eyelids are going down. Why? Why do these people, if you have a question, you can raise it on these substances? Because marijuana acts on cannabinoid receptors. Its therapeutic index of marijuana may be 100%, but it produces psychotic issues. You will start behaving like a psych person because it has reduced your nervous system. Your nervous system goes slow. You get it? Now we have talked about opioids, yes, like heroin, morphine, codeine, fentanyl, and oxycodone. You see that? And then we have talked about hallucinogens like cannabis sativa, marijuana, and ketamine, LSD, ketamine. Now, inhalants. There are some drugs that people inhale. Which drugs are these? These are like glue, fuel, aerosol, and spray. Rapid CNS. It goes to your CNS and blocks your some receptors. When they block your some receptors, you become high, you withdraw because now your brain is not functioning well. Your brain is working slowly. That's why sometimes in some countries you might find some young men or people sniffing glue. Glue is part of an inhalant. Now, what is the characteristics of addictive substances? The characteristics of substances that people like to be addicted to. Yes, you will find their characteristics. One is rapid onset of action. It works faster, the rapid onset. The next one, intense reward or euphoria. You know that euphoria, that effect. You start being high on an effect. That effect of euphoria. Develop of tolerance. The more you use, the more you develop tolerance. If today you took alcohol, like one bottle, you feel high. Tomorrow you come and take another alcohol, you add 2 bottles and you don't feel anything. You add 3. Tolerance. Withdrawal symptoms. Yes, the withdrawals are very bad. Compulsive use of despite harm. You get it? You know you are harmed, but you still use them. Yes, like in alcohol, some withdrawal symptoms are tremors, seizures, and delirium tremens. We talk about how tremors come. This one, we need to learn how nerves pass impulses. Why do you get tremors when you why do you get tremors when you are high? Let's see how you pass tremors. Now, your nerves are like this. Let me draw here something. Let me draw here something. Let me draw here something. Yeah, your nerves are like this, like this, like this. They have a cup. Yes, they have a cup here. Wait a minute. I'm drawing a diagram so that we can understand why tremors come. Why tremors come when you are addicted to alcohol. I'm drawing here a diagram to show you how tremors come. How tremors come. Now, when you have taken alcohol, this is a nerve. This is a nerve. Nerves look like this, the cleft. So when you've taken alcohol, let's say this one is coming from the brain, this one is muscles. So when you've taken alcohol, this is what happens. This is what happens. There are neurotransmitters that transmit impulse from this side to this side, from this side to this side. So alcohol comes and blocks this place here. Alcohol comes and blocks this because if this one sends signal to this one, if I block this one will not receive any signal. You see that if I block this one will not receive any signal. So why do you get tremors? Why do people get tremors? It's because now alcohol has blocked some of this. Alcohol has blocked this and has blocked this. And there are neurotransmitters. There's the what we talked about, neurotransmitters. There are some called acetylcholine. Acetylcholine is the one which transmits. So when it is supposed to jump from here to be taken, and this one is blocked, now you get a tremor because the receiving end is not receiving any neurotransmitter choline. You see, because one of the receiving end is not getting any neurotransmitter. So you start having tremors. But if you increase in alcohol intake, now it binds to both. Now the tremors stop. The tremors stop because the acetylcholine is not receiving and is not being taken. It's not being sent and it's not being receiving. So there is no fighting between receiving and sending. There is no fight between receiving and sending. So what do we do about this? This is when there is no signal between receiving and sending, that is where a person gets a blackout. You get it? Now the tremors have stopped because when the tremors are there, there is some receiving, but not enough receiving of the neurotransmitter. But when there is high receiving end, you become stable. When the alcohol has gone, you become stable. So what do we do to do what? To stop this effect of of of, of having tremors and that withdrawal symptoms are slow. The more you take alcohol, the more you are killing the finger-like things called the dendrites. So when you kill them, you become dependent because you will want to drink, so that you pile up and and be strong. Now we see benzodiazepines. They worked also as alcohol, and the tolerance to is very complicated. Tolerance is very complicated, and dependence also is very complicated. Stimulants like cocaine, which block the dopamine reuptake, intense euphoria. You see, they are not good. They are not really good on it. Now, opioids like heroin and oxycodone. You see, they bring muscle aches. You start having diarrhea because you are doing what? You are destroying some receptors in your body. Hallucinogens. You take a lot of marijuana. You take a lot of marijuana, and then what happens? You take a lot of marijuana, you start being psychotic. Why? Because it has blocked some sensations and some in your brain. You start huzzling slowly. If you notice people that take marijuana, they really talk slowly and slowly, which because their brains have been affected by some neurotransmitters. Now we go on definition of our depressive state. We go on substance medication in this depressive disorder is characterized by prominent depressive symptoms, sadness, loss of interest. People that are on substances, you will find them sometimes they don't have interest in some things. They're just there. As much as they use their substances, they are just there. Directly caused by the use of withdrawals from substances or medication. Yes, you see, substances are not good. How does this happen? As we just have said about the other substances, the depressive symptoms are believed to be to result from. Now, how are you depressed from substances? We talked about neurotransmitters earlier. We talked about neurotransmitters earlier, and we saw some neurotransmitters like dopamine and serotonin. When they are down in your brain, if you really, we say when you want to, if you revisit other videos as we go on with our program, you will know much about what you are talking currently. Some substances you will find out that these substances they reduce neurotransmitters like serotonin, dopamine, and norepinephrine in your brain. I've always talked about these three things: serotonin, dopamine, and norepinephrine. They cause by the substance they reduce because of blockage of receptors. Receptors are things that receive these neurotransmitters so that they can be metabolized and balanced in your brain. So the depression mostly is resulting into these neurotransmitters imbalance. Toxic effect of the CNS or withdrawal induced dysregulation of mood related pathway. You see, we learned about the brain and we saw there are centers like cognitive centers, like the frontal part of the brain which helps you, and the limbic system, which is a bridge between the endocrine system and the motor function. You remember that. You remember. If you don't remember, you just go through the videos and you'll be okay. Now, you see, a prominent and persistent disturbance in mood that predominates the clinical picture and characterized by this is now the diagnosis: depressive mood, diminished interest in pleasure and in activity. And we saw the brain how it gives us this. There is evidence from the history physical examination or lab finding that the symptom developed during or soon substance intoxication or withdrawal or after exposure to a medication. When you are exposed to a medication, you start exhibiting some effects of being depressed, some effects of being depressed. So we will usually know this person is under substance, and that substance is the one which is bringing depressive mood. You see, you see that. Now we have diminished interest in pleasure and activity. Pleasure, you understand what pleasure is. You just you are not into some things like sexual activities, things that may make you feel good. You are not interested in them. There is evidence from history of physical or lab finding that symptoms during or soon after substance intoxication or withdrawal exposure to a medication. Yes, if you are we have evidence from the physical examination, like you are smelling oxycodone or you are smelling alcohol. Yes, the substance medication is capable of producing such symptom. Like when you smoke marijuana and they are talking slowly, or some people smoke marijuana and they become aggressive. They start displaying psychotic uh, character. We will know. The disturbance is not explained by depressive disorder that is not substance medication induced. The disturbance does not occur exclusively during delirium. Yes, the symptom cause effective distress or impairment in social, occupation, or other important areas of function. Yes, common substance that may be involved. The common substance that are involved in uh, in abuse, we have alcohol. We have gone through these substances. We have alcohol, cocaine, amphetamine, cannabis, opioids, hallucinogens, you get it. Cocaine, we talked about it. Amphetamines, we talked about it. Opioids, yes, we talked about it. Hallucinogen, we talked about it. Yes, hallucinogens like cannabis. Sedatives and hypnotics or anxiolytics, benzodiazepine, anxiolytics, benzodiazepines, you understand, like benzoxin. Benzoxin, some children go to some hospitals, they say they be added that it's your medication and it's had to be given because that is a prescription only drug. A prescription only drug. Yes, yes, yes. We are going so well. Now, there are some medication like corticosteroids, prednisone. There is a difference between prednisone and prednisone. There is a very big difference between prednisone and prednisone. The active part of the drug is prednisone, but the one which is not active is prednisone. So if you go to mostly prednisolone is blue in color from some companies, but prednisone is white in color. These two have a difference. So when you take prednisolone, it acts faster. But when you take prednisone, it has to go to the liver to be metabolized first to produce prednisolone so that it can work better. And then we have isotretinoin. Isotretinoin for acne. Ladies, isotretinoin. You are fond of using isotretinoin a lot. Please reduce. It helps you somehow, but more use is addictive and it may cause problems. It may lead you to have depression. Interferon alpha hepatitis used in cancer, or hepatitis. You get it? They make you feel the feeling of relaxation and stress relieving. But you see, when you are addicted to them, they may bring depression. You get it? Yeah, we have beta blockers like propranolol. Propranolol, it helps, it reduces your brain function. You get it? Your brain function. So there are some people who are hypertensive and they use propranolol. Yes, yes, they use propranolol. Propranolol, it may be used in hypertension because it's a beta blocker. Beta blockers are some cells that are in the heart and also the kidneys or the muscles of not the muscles, the lungs. So what happens here is when you use propranolol, what happens is they block the beta cells, so they don't function as normal. They don't function as normal, and when they block the beta cells and the beta cells are not functioning as normal, the heart reduces the pumping effect. So beta cells are also found somewhere else. So you feel the effect of relaxation and you feel nice. So these drugs, when they are prescribed in hospital, someone may be addicted to them because they are giving them that effect. Yes. Contraceptive or hormonal treatments. Yes, yes. Like those progesterone on the pills. They give someone some relaxation and that person feels good, nice, very nice. You should go slow on them, talk to your doctor, know the better one to use. We have Parkinson's medication. Parkinson's medication, e.g., levodopa. Levodopa, when dopa receptors are not producing enough dopamine neurotransmitter, dopamine neurotransmitter, you are given this. They may give you some feeling, and then you do what? You be addicted to them. Yes, yes, yes. Depressed mood is one of the clinical features, and hopelessness. We have always talked about neurotransmitters, and we talk about the depressed mood, sadness, hopelessness, and hedonia, the loss of pleasure. We talked about this. These are the clinical features. We have fatigue, sleep, change, appetite changes. Some people may eat a lot, some people may eat uh, some little food, feeling of worthlessness, guilt of what you are doing because you are addicted to something, difficult in concentrating, sometimes suicidal thoughts, symptoms often resolve after stopping the substance. Okay, onset and cause. Symptoms begin during use. When you have used the substance, the symptoms begin intoxication or withdrawal. Use within 1 month, usually within 1 month. You see that if the substance is removed, symptoms typically improve within days to weeks. Symptoms improve within days to weeks. If symptoms persist after cessation, another depressive disorder should be considered. You get it? If someone stops using these substances more than 1 month after cessation, you must find out, because I'm sure there are some people who are into drugs. These people are into drugs and alcohol, but they will usually want to lay behind their stress there. So this is says if symptoms persist after a month of sedation, you should do what? Consider another diagnosis. There are some things that the other diagnosis that we may consider, like major depressive disorder, we talked about it. Persistent depressive disorder, talked about it. Adjustment disorder, disorder due to another medical condition. Bipolar disorder. Bipolar disorder, we talk it separately when it comes to the type of it. Now we have other issues here. You see, these are patients. These are patients, and I think if they are patients, we should manage them. We should manage them, and management is a key factor when it comes to uh, depressive disorder and substance use. Why do people use alcohol? Why do people use cocaine? Why do people use some things like barbiturates? Why do people use? We should find out why. So when it comes to management of a person, let's take a person that has been using, what can we call it? Cocaine. Cocaine. And we have put these products and let's go back and see, because we really need to know how to manage these people that are using substances. We should really know. We characterize them as depressants, and then stimulants, and then hallucinogens. And there at hallucinogens, we saw some cannabis sativa. We saw cannabis sativa is banned. Even if it is sativa or it is cannabis indica, all those they do the same thing. It doesn't matter if it is indica or sativa, both they do the same. So we have characterized these drugs under central nervous system depressant. They depress your brain. Alcohol, it gives you a feeling of relaxation and this inhibition. Yes, but you see, when you want to stop alcohol, you will get tremors, seizures. Yes, tremors and seizures. And I've explained with our diagram here so well about the neurotransmitters, how they are uptaken, and how they are uh, introduced to the other synaptic clefts. These are called synaptic clefts. So when you want to pass, when you want to pass, when you take alcohol, when you want to take, you take alcohol, and you see they are CNS depressants. How do they depress the CNS? How is your central nervous system depressed? It is depressed here because when you are pressing, as you are sending a signal, the nerves are sending a signal. The nerves are sending a signal. This is what happens. I repeat so that we know. This is how the central nervous system sends a signal. These are nerves. I've drawn nerves. So these nerves, they have some chemicals that are sent to this other nerve. These chemicals, like they are called acetylcholine, they round here, they play around here. So when you send a signal, it is pushed to the other side. It is pushed to this side, and that's how your brain gets signals. So when you take alcohol, it does what? It inhibits glutamate effect. Glutamate. So at the centers of glutamate, it is blocked. So the other receptor does not receive. So when it is not receiving, what happens? You start having tremors because that one is not sending, it is blocked, and this one wants to receive the signal. But now it's not receiving because you've taken alcohol. Those people who are addicted to alcohol, you'll always see them shaking. So when they take alcohol, you see them, they are calm. The shaking has stopped. You wonder why. And then they say, today I have not taken my dose. No, it's not because you have not taken your dose. It's because you have taken alcohol and it has bound to the other places that are receiving the signal. So it is balanced. So if it is balanced, you will not shake because the neurotransmitter is balanced. This is how addiction is. Mhm. We are continuing. We talked about depressants, alcohol, benzodiazepines, people that use diazepams to relax, and losartan, barbiturates. Yes, those are depressants. Then stimulants, those drugs that you take and then you feel you are high, you are good, you are feeling nice. Yes, you're feeling you are on the top of the world. Remember, if you have a question, please just post it on the chat and then we address it. If you don't understand anything, it's good you learn, you can help someone. Post it on the channel, then you can just put it on the chat and then we will address it. The stimulants like cocaine, cocaine. Cocaine stimulates, blocks dopamine reuptake. You see, it blocks. Dopamine is produced to be taken, to be metabolized, but it blocks. So dopamine piles up. So when it piles up and it's something that gives you pleasure, dopamine is a receptor that makes you feel you are happy, you feel pressure, you need something that gives you pleasure. So when it is high, what do you feel? Stimulated. You become high, you talk a lot, you do things, people feeling you are very happy. In another way, you have made yourself happy by stimulating dopamine reuptake. You see, you have blocked it. So you are feeling high, intense euphoria followed by crash. Now, after dopamine has gone high, 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 what happens? You knock out because the level is high and beyond what you need. And then we have amphetamines, those people that go to the hospital and they are given amphetamine used in ADHD, narcolepsy. Yes, ADHD. You remember about our topic about ADHD? We talked about ADHD. Why? We talked about ADHD in a topic about mental health. Hmm? Minute in a topic when we were introducing mental health, attention deficit hypersensitive disorder. You see, it's a common neurodevelopment disorder that affects boys a lot and adults. In attention hyperactivity, yes, hyperactivity or impulsivity. You do things impulsively, faster, which is not okay. Which is not okay. So you are given these drugs like amphetamine to increase dopamine and norepinephrine. You see that. Then we have caffeine and nicotine. Caffeine and nicotine, stimulants of the central nervous system. Opioids like heroin, morphine, cocaine, and fentanyl. Opioids. You see? Yes. These opioids are not good. Yes, Asha. Hi. Good morning. We are dealing with substance of abuse. Those people that deal with substance. Mm. We are dealing with substance and substance alcohol abuse. Mhm. Yes. Here, where you are, it's morning. Here, it's afternoon. It's afternoon. Yes. Now we continue. We continue. Hallucinogens. Yeah. Those people like marijuana. Marijuana people who like taking marijuana. That is your place. Inhalants, we have seen that. Now, treatment approaches. Management is very important when it comes to treating these conditions. It's very important on management because a person is addicted to these drugs, and this person now want to get away. Once you identify, you need to identify and remove the offending agent. Stop or taper causative, abusive, or medication. You need to stop, which is very hard to stop. But you see, the first thing is to know what is causing depression and what is causing this person to have this. You stop it. Then you check what symptom is this person producing. Hmm? Supportive therapy like psychotherapy and counseling. And then we have pharmacological, and the antidepressant may be temporary if symptoms are severe or persistent. You introduce antidepressant. Monitor for withdrawal symptoms. Monitor for withdrawal symptoms. Patient's education. Educate the patient. At times, it is very hard to deal with the very hard to deal with withdrawal, but you need to educate the patient. Eh? You see, sometimes you need to treat the disorder, underlying disorder and substance. Yes, you need to treat the underlying disorder. Let's check on step by step treatment of addiction. How do we treat step by step addiction in detail? The first thing, because we have seen we are dealing with a person who is addicted to a substance. And this one, at times, it is supposed to be given as a multidisciplinary commitment. Not only one person, as a multidisciplinary commitment. Now, we go to determine step one, determine the presence and severity of substance use. You determine the severity of substance use disorder. Severity. Mhm. Use standardized screening tools, sketch questionnaire, DAST assistant. Those are things that are formulated to as a questionnaire to grade this person. You should know type of substance used, frequency, duration, quantity. You see, this now we are screening to know the addiction to this person. Type of substance used, frequency, duration, and quantity. How much? Sometimes you may hear a doctor asking a patient, how many cigarettes do you take in a day? You see? Yes. Physical, psychological, and con- psychological and social consequences. Very important. What is the consequence of using these things in public? When you take them, do they have any social positivity or negative positivity? Do they harm you after you are out of them or the dose has gone out of your body? Do they harm you psychologically? Do you think you are depressed? Do you think you are okay? These are the questions you should ask a person when he is in this state. But remember, you ask this person when he is willing and has come for help. Assess for concurrent mental concurrent mental illnesses like depression, anxiety, and psychosis. Psychosis is very important. You should assess, are they are there any forms of psychosis? Is there depression? Is there anxiety? Medical evaluation, liver, kidney function, infectious disease like HIV, hepatitis. You get it. The liver, when you take a lot of alcohol, it damages the liver. Those are things as a doctor should check. It's called the liver function test. You check some substrates and some catalytic chemical so that you know, is there any damage to the liver or the kidney. Check for infectious disease because when people are intoxicated, what happens? Sorry, he is involved in some things that they are not supposed to be involved in. Like what? Sexual activities. Another thing is people that use heroin, they exchange needles, syringes, and you see that may be a bottle of entry of HIV. You are using a needle or a syringe that someone else has used. Hmm? And you know, having hepatitis B and C, or HIV, may not only come from having sex or exchanging body fluid through sexual contact. It may come by exchanging fluids through some gadgets like syringes and needles. Yes. Now we go to medical evaluation. Yes, that one we have covered. We have covered step one very well. Screening and assessment. We have said substance used, frequency, duration, psychological, physical, and social consequences, and assess mental issues like depression, anxiety, and psychosis. Is there any psychosis? Yes. We have medical evaluation. We have seen what to evaluate: liver function, kidney function, infectious disease, HIV, and hepatitis B and C. We go to step 2. Remember what we are doing: step by step treatment of addiction. We want to treat a person who is addicted. We want to help this person who is addicted to a specific substance. So we go to what? Step 2. Step 2, we will see diagnosis and motivation building. Confirm diagnosis and enhance patient's willingness to change. Let it be willing. Confirm the diagnosis. Addicted to what? Depressed to what? Because of what? You get it? What is this substance that this patient is addicted to? Mhm. Is this patient willing to change? Is this patient willing to leave the addiction product so that he can live a happy life? Yes. Establish severity. Is it mild, moderate, or severe? Because you may be dealing with a person who has total impairment. This person has hepatitis, has HIV, has all the symptoms that you may be finding out, and he is totally impaired. The neurotransmitters that diminish the brain is totally out. He's living in his world, hallucinating, euphoric. You check it because of prolonged use. And if when this person has not used, you find this person is not responding correctly to the world, to the social environment. So what do? You check if it is moderate, severe, or mild, or mild. Mhm. Use motivational interviewing to explore ambivalent and build intrinsic motivation. So when you are interviewing, you don't be so professional to the patient. At least be professional, but have a motivating factor. Yeah? Identify, find out the patient's goal. What is the goal of the patient? Why has this patient come to you, or you as a family member or a person, for help? What triggered the substance use? What triggered the substance use? I always say at times, and I've always looked at some people who take much alcohol. So some people, abuse is abuse is taking a lot of substance. You get it? Abuse is taking a lot of substance. Taking minimal at required levels is not abuse. But there are some substances that you're not supposed to take. Even if it is minimal, you're not supposed to be taking cocaine. Why? You're not supposed to be overusing marijuana. Overusing marijuana. Although the same marijuana in some countries it's legal and some countries it's not legal. So according to the constitution and the laws of your state, I will say take as per you are required. You get it? So when you are interviewing this person, you ask this person, what is your goal? Why did you start in using this thing? At times, you will find out that many people in the society, and I say, they are not taking these substances because they like taking alcohol. Alcohol is a depressant of hi Lawino, hi, hope you are doing good. We are talking about addiction and depression. Welcome to the channel. If you have a question, you can ask as we continue. Now, some people don't take alcohol because they want to. Excessive alcohol, because some people take alcohol but not excessive. So we ask ourselves, why do a person take excessive alcohol? Hmm? Why? Why? It's because this person may be hiding behind something. This person may be hiding behind something and is using these drugs so that he can, at a particular period, this person cannot be thinking. Yes, some are stressed up. And you see, stress is what we are talking about. We are talking about depression and substance abuse. And we have looked at several factors from the beginning about stress and substance abuse. So, when we talk about stress and substance abuse, we are in management. How we can help these people? How can we help these people to stop being stressed up? So here is a checkout. We have reached to how we can help, and we have said first you have an approach. You create a questionnaire. Yeah? You create a questionnaire. Or peer pressure. Yes, yes. Lawino has come out with a topic. You see, this is a discussion. Peer pressure, and that's where we are now. We are saying you identify. We started by management, and by management we started by screening and assessment. You screen to know what this person is using, type of substance used, frequency, duration, and quantity. How much frequency, which frequency do this person use, how long has he used, how much does this person use the quantity. And the things that we are talking about here, the substances, we have talked about several substances that are abused. Let me repeat these substances. Those ones that depress the central nervous system, we have talked of alcohol, benzodiazepines like diazepam and lozapam, and barbiturates. Then we talked about second, stimulants like cocaine, amphetamine, and caffeine. And then we went down to opioids, heroin, morphine, codeine, fentanyl, and oxycodone, and then hallucinogens like marijuana, cannabis, indica, and the drug we use in hospital called ketamine. Yes, and then magic mushroom. There's a mushroom which people take and then they feel high. It's called an hallucinogen. And then we say inhalant, the fifth one, glue, which the children and some people sniff, inhalant. Those are the substances that we have just talked about. We have talked about how nerves are depressed, how a person takes alcohol and after some time the person starts to shake. But when this person increases the dosage, the shaking stops. We have seen why. Yes, and on management now, we are on management, and on management we have seen one, you identify, you screen, assessment, and then the second, we were on the second, diagnosis and motivation building. Yes, you be a motivational person to this person. You be someone who is trying to help. Intrinsic motivation. Don't be a person who is not trying to help, because substance abuse destroys very many people. Substance abuse destroys so many people, and we are trying to help. Now, you have said peer pressure. Yes, peer pressure is part of it. This is where we see triggers, consequences of alcohol use. What is triggering this person? What is one of you has said peer pressure, peer pressure. You see peer pressure. So some stresses. There are some people who have they are blessed in their family. You are the only one who has come out as a breadwinner in the family, and everything is within you. Everyone is wants you to help. You find this person going to drink because, yes, this person is the breadwinner in the family, the mother, the other siblings, plus the cousins are looking at this person. And this person now, the only because this person does not want to talk to someone, he starts to go to use something like alcohol or cocaine or bang, so that at a particular moment he can forget about all these bargains and stresses. There are some medical issues that makes a person go. You have a medical issue, a chronic one. Some people cancers, you understand. Some people, you understand, they have some issues medically that may stress them up to make them go to substance abuse. Find those triggers. Talk to this person. Let this person come out and say, I drink because I want to get away from this. But do you think smoking, drinking, using this substance, peer pressure at a young age, because I've noticed even peer pressure is not at the young age alone. Even other people who are not having young ages, they still they are adults, but they'll still be influenced with with peer pressure. You see that? Now, identify the triggers you have and consequences, and then we continue. Step 3, detoxification. Now, this is the stage whereby we will talk about how to detoxify, withdrawal management of that subject that a person is like. The subject may be marijuana, cocaine, ketamine, mushroom, you see, hallucination. Someone is just uh, he likes benzodiazepines, diazepams. You get it. So how do you manage this? This is the third step. The third step: safely manage symptoms and stabilize the patient. Manage symptoms. You- we will go back to, when we come to manage symptoms, we go back to what substance? Alcohol. What are the symptoms? Tremors. We have talked about the tremors. Will you go back and give the patient alcohol to stop the tremors? No. There are some medical drugs that we use to stop these tremors and seizures. Seizures like phenobarbital. A person is highly using alcohol and this person has seizures. What will we do? He has been brought to the hospital. You have screened danger signs. You have screened everything. You do what? You give the drug to stop the seizures. Benzodiazepine, tolerance and dependence. You stop it. Yes, cocaine, euphoria. You see, you try and help that. Amphetamine, mild stimuli, nicotine addiction. You see, you stop that with low muscle X, hallucinogens. You get it, marijuana, dependence. You stop it. Now we go on, like inpatient or outpatient detox depending on severity. So the dosage of drug that will be given, it depends on the a drug that you are dependent on and the dosage that you've been using. You see that? And the dosage that you've been using, like benzodiazepines, e.g. diazepam and lozapam, thiamine, multivitamin. You see, medication used depends on substance. Like alcohol, you'll be given like some benzodiazepine. If we are used to alcohol, it is depressing, you'll be given some thiamine, and multivitamins. You'll be given some multivitamins so that you, the depressant cannot continue working, the tremors can stop. This person is dependent on alcohol. So if this person is dependent on alcohol, how can we stop the tremors? You see that? Opioids. Opioids, methadone, buprenorphine, buprenorphine, and clonidine. They, you see that? They help. Benzodiazepine. In benzodiazepines, like diazepam, you see what we usually do, you gradually taper off, slowly by slowly. You taper off. If the dosage is 200 milligrams, you come down to 150, tapering off. If the dosage is 100 milligrams, you remember at the beginning, you you we talked about when the step one, determine the frequency and the dosage. Yes, now you start tapering off slowly. This is the significant part in that. Stimulants, cocaine, use appropriate supportive care. You should monitor vitals, BP, because some substances, they may interfere with your heart. You've seen like propranolol acts on the beta cells of the heart. So when this person has used them for so long, the beta cells are used to be depressed. When you stop, and they are actively working, now you can get high blood pressure and you may collapse. You may get a stroke and you may have a problem. Eh? You see, when you get a stroke, like transient ischemic attacks, you may end up having a bad day, or you become physically uh, impaired, and it's not good. Now, monitor vitals, hydration, sleep, and mood. Nutritional support, duration 3 to 4 days. You see, it's the rehabilitation. Rehabilitation. Be it this person is in inpatient, or be it this person is in outpatient. Rehab is very important. Hmm? We have seen about cognitive in behaviors, cognitive behavioral studies, cognitive behavioral studies. How does this person behave now that this person is not using these substances? How does this person behave? Hmm? Contingent management. If this person has stayed like 1 month or 2 weeks without using the drug, you reward with something. Hmm? You may form a rewarding system so that this person be part of the management. You know, so there are two ways of managing a patient. One, where you are just managing, the patient is not in it. But there is this part of management where the two parties are really in it. Now the patient will want to be in it, to at least do something to get better. You see that this patient is striving to do something to get better. Motivational enhancement therapy. You motivate, forming groups like Alcoholics Anonymous. Yes, the 12 steps program. Hmm? Let's see what is the before we go to medication assisted therapy. There are 12 steps anonymous. Let's see, 12 steps addiction. The 12 steps of addiction management. You see, one is we admit we we were powerless over our addiction. You see, a person is addicted to substance. This person should admit that substance was the one which was running. If you are the person, you should admit I was the one who was undergoing this addiction, and and I was powerless over it. Mhm. Number two, came to believe that a power greater than ourselves could restore us to sanity. You see that you admit these are 10 steps addiction recovery. You may introduce this to a patient, talk to that patient about it. You get it? Hmm? Came to believe that a power greater than ourselves could restore us to sanity. Some powers more than you can bring you back to sanity, to be a good person to the society. Most people that are overpowered by addictions, in the society, they are looked upon as people of no one with some people. It's not good to do that because now these people are undergoing their own issues, and these people are really suffering from several issues that they are struggling with. So, when you are talking about addiction issues, addictive substances issues, don't push them away. Mm? If you see a person is addicted, you are the husband, you are the wife, you are the brother, mother, you are the your sibling, you don't a neighbor. Don't push this person away. Why? Because this person is undergoing something that you will not understand. Because taking something of addiction signifies a problem that is pending. Or when you look at that person taking that thing excessively, it means there is something hidden behind this. So we are in the second part. There's 10 steps. Came to believe that a power greater than ourselves can restore us to sanity. You see that? Yes. Made a decision to turn our will and our lives over to the grace of God as we understood Him. That is number three. Made a decision to turn our will and our lives to the grace of God as we understood Him. You see, if you are a Christian, Buddha, you see that part. Religion. There are some people who are not religious. Yes, you will tell them to say that part in their way to what they believe. But I think 90% or 75% of the world is religious. If you are not a Christian, you are a Hindu, you are, and all these people, we respect their will. We respect how they respect their religion. See that? And those that are not into religion, we respect their will again. And we should be telling them how to go on. Number four, made a searching and fearless moral inventory of ourselves. A searching and fearless moral inventory of ourselves. Inventory. What are you? What have you learned? If your life was a movie, how would you watch it? You get it? Of yourself. Hmm? You see that? Admit to God, to ourselves and other human beings, the extract nature of wrongs. The extract nature of wrongs. To what you believe in and to humanity, to other humans around you. The extract nature of wrongs. What are these wrongs that you know? Hmm. The extract nature of wrongs. We entirely ready to have God remove all these defects of characters. If you have a defect, whatever that you believe in, tell God to remove it. Those defects. Make a list. We are number seven. Humbly ask Him to remove our shortcoming. Yes, to the society. Because when people look at you and then they are seeing a person who is addicted and is worthless, you see that is a shortcoming. Make a list of all persons we have had harmed and believe willing to make amends to all of them. If you have ever been harmed, you understand? Yes. Made direct amends to such people wherever possible. Think about the others who are addicted. Number nine. Mhm. Continue to take personal inventory. You continue to search yourself, and when you wrong, promptly admit it. Yes, when you wrong, admit. When you take substance, you admit. Continue to take personal inventory. Number 10, when you wrong, you admit. Number 11, sought through prayer and meditation to improve conscious contact with God and or with what you believe in. Yes, having had a spiritual awakening as a result of these steps. You see, The key concept of 12 steps of approach. 12 steps of approach. The key concept. What do they talk about? They talk about honest and acceptance. If you go through what we have gone through, this key concept, they talk about honest and acceptance, surrender to a higher power, self-awareness and accountability. You yourself, research yourself. Look your life as a movie. Do you like it? Search yourself. Hmm? You admit I'm wrong. Hmm? Your self-awareness and accountability. You admit I'm wrong. Make amend and repair how. Repair where you went wrong. Do good. This is for a person who is addicted to that substance. Yes? Ongoing self-reflection and service to others. Self-reflection and service to others means, oh, yes. Mhm. We continue. We are on the step of rehabilitation. Add psychological and behavioral aspect of it. Address psychological and behavioral. We have said cognitive behavioral therapy, change through patterns and behavior. Contingency management, reward sobriety. Mhm. Motivational enhancement. We have talked about 12 steps program like alcohol anonymous, narcotic anonymous. You see, now we are dealing with a person and not uh, an animal. When a person is born, he gets this character from the society. He's like an empty computer which has not programmed itself for any program. But you program it. Now, when a human is born, he's programmed by the copying of codes that he gets in the society. So when this human copies the code that he gets in the society, what do? If they are negative? You start programming again. So what we are doing right now is programming a person who had adapted a bad program. You see, this is a human being, life. We should protect life. Hmm? Now, if we protect life, how do you protect this life? Yes? Look at that person as your brother. Look at that person as your sister or as a relative, a person you friend, the most close person to you. We go to medication assisted therapy. Medication assisted therapy for opioid use. For a person who is using opioids, what do? We use methadone, buprenorphine, naloxone. Naloxone is a painkiller, but it may be used in medication of opioid disorder. Opioids, yes. Like, you know, naltrexone. Naltrexone, this one helps so much when it comes to alcohol addiction. Naltrexone. Naltrexone is a, but you see, you cannot start taking it. You really have to have a prescription. For alcohol use disorder and abuse, induce sickness when alcohol is confused. You see, naltrexone. Naltrexone, people that love alcohol. hmm, If you find naltrexone, naltrexone will reduce the craving of alcohol. One day you will see how naltrexone reduces craving of alcohol. Acaprosate restores brain balance. Caprol, caprostate. It restores brain balance by bringing back the neurotransmitters and bringing back the health of the brain. Psychoeducation. Teach teach about addiction, relapse prevention, and health lifestyle. Supportive therapy. Yeah, you teach those people about we have gone about to the 12 steps. You remember the 12 steps that we have gone about them. when you teach about addiction, you don't forget the 12 steps. You don't forget the 12 steps. I'll go to the 12 steps again. We admit we are powerless over our addiction. One. Number two, came to believe that a power greater than ourselves could restore us to sanity. Uh-huh. Number three, made a decision to turn our will and our lives over the care of God as we understand Him. Yes, or the person, what you believe according to your religion. Yes, because we are speaking to so many people. Number four, made a searching and fearless moral inventory of ourselves. Mm. Number four, made a searching and fearless moral inventory of ourselves. Admit to God, that is number five, to ourselves and to other human beings the exact nature of our wrongs. Be true to yourself. Admit the exact nature of yourself if you want healing. Yes. Number six, we entirely ready to have God remove all these defects of character. According to your religion, what you believe in, entirely ready to remove all these defects and character. You see, this is a person who has accepted. Who has accepted. Number seven, humbly asked him to remove all shortcomings. What do you believe in? Do you believe he'll remove all the shortcomings? Mhm. Number eight, made a list of all persons we had harmed. When you took alcohol and started shouting, insulting every person, did you take a list? We are going through the 12 steps of addiction recovery. Imagine 12 steps of addiction recovery. Hmm? Take a list of all people that you harm, including your family member that you are telling you to stop this heroin, but you insulted them. You get it? Eh? I'll repeat stage 8. Made a list of all persons we had harmed and become willing to make amendments to all of them. Yes, we continue. Made direct amendments to such people wherever possible. Go and tell that person, I'm sorry, it was not by my will, but I'm trying to get out of this addiction. Now, this one is another step that you have. You have talked to, yes, my teenage sky. I see you around. We are talking about addiction, and now we have reached as 12 steps of addiction recovery. The person have agreed, I want to recover. So there are 12 things that this person you should tell for this person to recover. We are at number 10. Number 10, let me type this. We are number 10. Now we go on. Continue to personal inventory, and when we are wrong, promptly admit it. When you are wrong, admit I am wrong. I took heroin, I took this hallucinant, which is bang. If anyone has a question, let's ask. I will try to help where necessary. Admit it. Sort through prayer and medication to improve our conscious contact with God or your religious thing that you believe in. We understand Him, we pray knowledge will for us and power to carry out. Have that spiritual power to get out of it. Have that supernatural power that tells you, I can get out of this addiction. Having a spiritual awakening as a result of these steps, that is number 12. We tried to carry this message to addicts and practice the principles in our affairs. You see? Mhm. And we have said key concept of 12 steps in approach of addiction. One is to give you honesty and acceptance. I am wrong. I need help. Number two, surrender to high powers, supernatural powers. I've said we all are religious, and there are some people who are religious. They still believe in something. You get it? It is not necessarily religious, can be a person concept of God or community support. There's those people that believe in community support. You get it? Very important and nice. Self-awareness and accountability. Key concepts. What do they do to this person? They give this person self-awareness and accountability. I want to change from this addiction. We have seen those drugs that you can be addicted to, but it gives me the self-awareness and accountability. Everything I do after I have accepted I want to change, I have to be accountable for. You get it? They are our brothers, they are our sisters, they are our guardians, they are our parents. Everyone in the family has a problem of addiction, one or two. They are not animals. These are people that are with us. These are people that we love. Don't look at them as animals. Let's help them. You get it? Key concept. What do they do? Making amendments and repairing harm. Or, or ongoing self-reflection and service to others. It is supposed to be an ongoing self-reflection and service to other people. You get it? Those are the 12 steps and what they do to a person. How 12 steps program help? How do this 12-step program help? Provide peer support and accountability, encourage personal responsibility and spiritual growth, help rebuild relationship and sense of purpose to the society, sense of purpose to the society. Other lifelong recovery tools, not just short-term fixes. Someone may think, let me take this drug from a doctor, like I've said, naltrexone. It helps addiction in alcohol. Naltrexone. That is a medication we take to reduce addiction in alcohol. You see? But now, that may be a short course. Within a time, then you have a relapse. You are drinking a lot. You see, these 12 steps will make you understand that this is not a short term course, it is a lifetime thing. Hmm? Accessing 12-step program. Reach out to a doctor, a person who can help you to, to get away from that addiction that is getting you depressed. Psychoeducation. Psychoeducation. Teach about addiction, relapse prevention, and healthy lifestyle. Yes, we were. That was its step 4, rehabilitation. We were in rehabilitation. Now, the step 1, we talked about screening and assessing what type of product is this person using, duration and quantity. We went to step 2, diagnosis and motivational building. Diagnose and motivate as you help. Step 3, detoxification. Detoxification, withdrawal management. And when a person is detoxifying, we'll find in alcohol you can use benzodiazepine, some multivitamins. I've explained why multivitamins, they help nerve growth. Yes. Opioids, we use methadone, buprenorphine, buprenorphine, and clonidine. And clonidine, benzodiazepines, we gradually taper off. There is nothing we can do. If this person was using 200 milligrams, we go to 150, we go to 100, and we go and stop using stimulants like cocaine and meth, usually supportive care, as we taper off, monitoring the vitals, sleep, and good. There we go to step 4, which is rehabilitation. We have talked about rehabilitation, and in rehabilitation, we have seen the 12 steps that we have talked about and what is the function of the 12 steps. The key function of the 12 steps is one. It gives you what? Self-awareness. Full stop. We go to medication. Yes, medication, that is step 4 still. Psychoeducation is in step 4. You get it? And then we go to aftercare and relapse. Aftercare and relapse. Aftercare and relapse. Maintaining long-term sobriety and prevent relapse. Yes. Maintaining long-term sovereignty and maintain aftercare and relapse actions. Ongoing outpatient therapy, group sessions. This is where we have group therapies. You identify some people who are doing well in this problem, and then you bring them together to help each other. But remember, as you do group therapy, you should be very careful that they are not helping themselves again to go back. So group therapies should be led by someone who is sober and someone who is not using in that group, so that you can help to monitor how these people are going, how one is responding to the group, and how the group is helping each other. Relapse prevention training. There are some trainings that you undergo that they train you how not to relapse. And if relapse is there, how can we come out of the relapse? Anyone who is getting into the platform, I welcome you. And as we talk, please, if you have a question you may want to be helped, you just ask, or if it is private, I usually give out my email address. Just send an email, and I will reply. My services are free of charge, wherever you are, free of charge. Now, relapse and prevention. Recognize high risk situation, develop coping skills, emergency plans for craving, continue match if appropriate. Participation in peer group and groups, very important. Regular checkups with addiction counselor or psychiatrist. Yes, you will see in some countries, some people are given a number. If you are willing to change, every week you should go and visit that counselor or psychiatrist. The person will tell you how, if you had a relapse, if you had any physical problem, if you had any problem that you think would came out of coming out of what you are addicted to, and he will write down. Yes, that is very important. Monitoring. Even if a person wants to change and this person is in a group, this person needs close monitoring. Yes. Step six. Step six is social reintegration. Reintegration is coming back to the society as a person who has changed. You see, it is not a simple thing as you think, because this is a person who was living in his own world, addicted to substances. This person had funny friends, and now is integrated to the society, to other people. How does this person come back to the society to rebuild himself or rebuild relationship to whatever he's having? Vocational training, re-employment support. Find this person something to do. Let this person not go back home to do nothing. Even if this person is elderly, you or is a guardian, you find something for this person to do. Because the more this person stays without doing something and bored, the more he'll start thinking of going back to whatever she was doing or he was doing. It's very important to get to a vocational training center to find something to do. In Kenya, I saw the last government had a program called Kazi Mtaani. Kazi Mtaani is young youths that are employed are given some jobs, manual jobs like cleaning the roads, cleaning some public areas, so that they can have something at the end of the day. And you see, this Kazi is job, Mtaani is home, the area. So the people of the area, they are organized and given some token to work. It was called that, and it helped the youth to come out of addiction and stay away from addiction. Yes, those ones. Those are rebuild family relationships. We have said any person that is addicted is our brother, is our sister, is our relative. Relationship matters. Find safe and sober housing. You've seen, it's very unfortunate when we talk about safe and sober housing. There is no country or area you will ever travel to and you find there is no homeless people. Very sad. I usually say if government will be good, they look at this matter because most drugs and alcohol are in these homeless people. They are the ones which are supplying, they are the ones which are doing all those things. But you see, the others, not all of them do this. Homeless people, because of desperation, they will involve themselves in anything to get something. So most drug peddlers, they may tend to use these people to do illegal things because they know they are desperate and they can do anything. So we have a person has come out of a rehabilitation center. This person does not have a home. This person goes back. You see that, to be homeless. What do you think about it? If this person goes back to be homeless, what will happen? He'll go back to be tempted to do the same things that he was doing. If he was getting some money from peddling drugs, from the drug peddlers and getting some little amount of money, he'll be tempted to take them, to take the drug and use them. So when a person you've struggled, you have used a lot of money to rehabilitate this person, find this person something to do, find this person where to stay, away from the environment that this person was used to, so that he may have the immunity and strong uh, mind not to go back there. Very important. Engage in meaningful activities. I've talked about Kazi Mtaani, which is job in the hood, like the Kenyan government did, the last government, this government has revoked that. And hobbies. What do these? I've seen in some elderly homes, there are some hobbies they watch, they play soccer, they meet the women, they make mats and they sell. That is something this person can be involved in. Management of co-occurring disorders. You see, we go to management of if a person has both addictions and mental illness. Imagine a person has an addiction and mental illness, depression. This is called dual diagnosis now. This requires integrated treatment. Yes, Sevelin. Sevelin, hi, you're at the platform. We are talking about addiction of drugs and alcohol and some other substances. So if you have a question, please raise it as we go on. Sevelin, welcome. Welcome to the platform. So we are going to another problem here. Yes, this problem is a person is dual diagnosed. You get it? This person is having an addiction, and having an addiction, he also has another problem diagnosis. How do we do? You screen the first, you check the problem, use necessary tools. We have seen the tools from the beginning to screen, motivate, build readiness to let this person be ready to change. Use of meds, monitor vital, supportive care. Yes, detox. How do we detox? That is another problem and a complicated issue when it comes to medicine. There, a doctor told me, how do we detox and the kidney is doing the job. Let's see how to detox so that we know what is detoxing. Detoxing is removing the substance from your body that are harming you. Substance. Hmm? Medical assessment, stabilization, withdrawal, management. You see, detoxing settings. We have not talked about we have gone through the steps. There is no any drug that you will take once and then you get detoxified. No, there is no drug. Mhm. Rehabilitation, we have talked about rehabilitation. prevent relapse, reintegration, rebuilding, going back to life. You see, we have talked about so many things today. Today, the session has been so long that we have gone through several things from the beginning. From the beginning, let me summarize what we have gone through. We have defined what substance is medication-induced disorder. We have said substance medication-induced disorder is a typical or depressive disorder that occurs due to psychological effects of substance, including drugs of abuse, medication, or toxicity. This condition is classified under depressive disorders. Mhm. We have seen how pathophysiology of substances, how substances have made us not to be okay. And we have seen neurotransmitters are involved, like serotonin, dopamine, and norepinephrine. They are highly involved in in the brain, and sometimes they harm the brain. That is how substance harm us. And then we have seen how to diagnose the substances. We have seen the common substances used and their abused, like alcohol, cocaine, amphetamine, cannabis, opioids, and hallucinogens. The normal bang, which is marijuana, is an hallucinogen, sedative, like benzodiazepines, medication like corticosteroids, yes, prednisone, we have talked about the two types of prednisone, isoterone, the acne drug, isotretinoin. Isotretinoin, we have talked about it. Interferon alpha, the drug that treats cancer. These are medication of addiction. Anticonvulsants, beta blockers, those people that are hypertensive. Contraceptives or hormonal treatment. Yes, we have talked about vaccinations. You see, we are talking about drugs of addiction. Why? Because they are mostly that are misused. And if you look at them, you will find that most drugs of addictions are drugs that are used mostly to people that are psychotic, to people that have mental issues, like benzodiazepines and the other hallucinogens. These are drugs that are used to people that have mental issues, but people use them in a bad way. You see? So you will find that alcohol, something like alcohol, is abused. People take alcohol at at uh, at a way that displays discipline. They are okay. They don't overuse alcohol, but there are some people who overuse alcohol, and then it brings so many complications. You see, it brings you liver problems, because of killing hepatocytes, the liver cells. But you see, here we are talking about abuse, overuse, using without a problem, and then it takes you, and you get what? You get depression. If you have a person who is addicted and is a family member or so, don't look at that person as an abusive person. Why? Because when you are overusing something like alcohol, it brings down things like serotonin, which helps you to be aware of yourself, cognitive functions. So as this person is insulting you and doing some things that are not proper, you should know that the substance of abuse have come in, and this substance of abuse is making this person's neurotransmitters to come down, and this person is not being himself. But if we help this person and balance the neurotransmitters and involved neurons, this person will be okay. You understand that very important about neurotransmitters and substance of abuse. Hmm? So we don't push them away. There are some Parkinson's disease medications like levodopa, they make people feel high because when you take levodopa, you are adding dopa neurotransmitter plus the other one that you are producing, and then you become high, stimulated. Depressed, you see clinical features. We have gone through clinical features of substance abuse: depressive mood, sadness, hopelessness, loss of pressure because you are using this substance at a very high position that you may be confused. Let's go on. If you have a particular question about anything, about the substances that we have talked about, please ask. We have talked about very many substances, but they are categorized into several substances. Let me repeat the substances. Central nervous system depressants, those that make you depressed. So they depress the central nervous system. We have talked of alcohol. We have talked of benzodiazepine and barbiturates. Benzodiazepines are like diazepam and losartan. And then alcohol, we know alcohol, all types of alcohol. Alcohol is alcohol. And then we have stimulants, those that make you high and stimulated. Cocaine, amphetamine, caffeine, nicotine, those ones. And then we have opioid narcotics, heroin. If you have a person in your family that is using these substances and you need help, please post the question or ask me for my email so that you may post, and then we discuss how we can help. We help people away that are not even around us, and we take them through the 12 steps. You get it? You get it? Oh, Saville, I didn't know you are a doctor. Today, you know, Saville, today you know I'm a doctor. My channel is always talking about mental health and helping people on how to be okay. So if you have Saville, a person you see is alcoholic and you really feel it and you need to assistance, please talk to us. Now we are going on. We see opioid narcotics, heroin, codeine, and fentanyl. I've seen oxycodone. Oxycodone is a very bad drug. Yes, it's a painkiller, but it's a painkiller, but it's addictive. And then we have hallucinogens. Yes, 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 yes. If you have a question about them, please ask. Please ask. Hallucinogens, the mushroom, those who take the mushroom that makes you hallucinated. We have ketamine. Ketamine, yes. Ketamine is an hallucinogen. When we are in theater and then we want to relieve pain or sedate a person, we may use ketamine. But you see, this may make a person hallucinate. So it's not used out there. We have cannabis. Cannabis, we have said about it. Cannabis is 100%, its therapeutic index is 100%. But you see, it will make you psychotic. It will not kill you, but will be psychotic. Those people who use cannabis sativa at a high, there are some countries that have legalized marijuana, which is okay, which may be used at a good amount or as particular. I don't know the rules because in my country marijuana is not legal. But when you use marijuana a lot, you become psychotic. You will start displaying psychotic issues. Inhalants, we have talked about them, and you have seen how inhalants can make a person psychotic. Now, let's see how the treatment approach. The treatment approach, we have talked about detoxification. We have talked about medications like methadone, buprenorphine, naltrexone for opioid. We have talked about nicotine replacement therapy. Nicotine replacement therapy like bupropion, like bupropion, warfarin for tobacco. Psychotherapy. Yes, help this person psychologically. Try to help this person to be someone in the society. Rehabilitation and support groups. Rehabilitation and support groups. Would you okay, if you go through this, I would really like to go back and go through the the 12 steps, the 12 steps of a person. As we continue to our last minute, I would really love to go through the 12 steps. And if you are out there, there are substances that are addictive substances. There are substances that are substances of addiction, but there are substances, there are drugs of addiction that are not supposed to be taken illegally. Alcohol is not illegal. What I'm talking about is alcohol is not illegal, but if taken excessively, it may injure your life. Mhm. How will it injure my life when it's taken illegally? Sorry. This is how it will be taken. It will injure your life. It kills your hepatocytes. Then your hepatocytes start removing bilirubin. We talked about encephalopathy, the the damage of the brain. You remember? We talked about it. Remember how bilirubin disturbs your brain? It may come to your alcohol dependence. Then there is cancer of the liver. Alcohol may bring liver cancer, alcoholic cirrhosis, due to heavy use of alcohol, bringing fatty liver. You see, when you have fatty liver, that is where you get alcohol cancer. And you see, having alcohol cancer, it means your eyes always will be yellowish because the bilirubin is high and it cannot be conjugated. The liver conjugates bilirubin. When I'm talking about conjugating, I'm meaning it changes bilirubin into water soluble. So when your red blood cells die in the liver, they produce this thing called bilirubin, the yellow substance. So this yellow substance is supposed to be changed to water soluble so that it can be absorbed by the waters that you have, the fluid that you have in your body, so that you can go to urinate it. It is a toxic substance when it is a high level. Or you can go to the loo, feces. But when your liver is killing the cells and these cells cannot be conjugated. They cannot be changed into water soluble. What happens? Now bilirubin becomes at high level in your bloodstream. Yes. Now if you have a person who is addicted to alcohol, please send that person this video and tell that person to go through this video very slowly. So when they die, the bilirubin is not being changed into water soluble. What happens? It starts to supply to go around your system, blood system, and then it reaches your brain. When it reaches your brain, what happens when it reaches your brain? Toxicity. Toxicity happens. Bilirubin is toxic when it goes to the basal ganglia. There is a video we have talked about the basal ganglia. You get brain injury, encephalopathy, you get brain injury. So when you get brain injury, you start losing yourself. Some people say that person has become like a mad person. Hmm? It's not you have become as a mad person, it's because you are sick. You have a fatty liver due to alcohol heavy use, and when you have a fatty liver due to alcohol heavy use, what happens? Kills the liver cells, and then you get encephalopathy. And then what do? You may go in a coma or die. You see that? So those are the issues. And then you see dendrites. We have talked about the dendrites, how nerve impulses are transmitted. We have talked about how a person shakes when he takes alcohol, why a person shakes, and when that person has taken some other alcohol, he becomes stable. It's not that this person is okay now he has taken alcohol. It's because he is continuing to destroy himself. We have said how he's continuing to destroy himself. Yes, we are continuing like that. Alcohol has adverse effects. Cocaine. You have seen how cocaine stops the neural function. The neurotransmitters goes high. You are stimulated, and then you go to a coma once you the receptors have removed dopamine they are blocked, and then it is at a high level. You go into a coma. Those are substances that we are talking about, and you see people that are using these substances are our brothers and sisters. Mhm. If they are our brothers and sisters, what should we do? Mm. we should we should we should uh, we should talk about them, and nitakupigia, I'll call you back on a session. We should talk about them and make these people know that what we are doing what we are doing is not is not what we are supposed to be doing. You get it? So we are supposed to think about our brothers. So I'm giving this session for anything. I've seen Sevilla said he asked them. If you have a question, please ask as we continue talking to this APF premium free benefit. As we continue talking about alcohol and addiction. Yes, Savin, tell me why do these people drink a lot? Why do you think these people drink a lot? Why do you think these people drink a lot? Yes, yes, yes. We are continuing. I think we are on our second hour, and we have talked a lot these these things of addiction, and whatever we are supposed to stay away from, whatever that we are not supposed to take a lot, whatever that we are stopped. I really don't know. Seville, stopping. We have talked about stopping. Yes. Poa. Wamekupigia simu? Bado, let me call the insurance person. Eh, okay, unaweza ni text. Text me, I'll reply please because yes. Okay. Okay, hakuna shida. We we are we are talking about addiction. You have said um, okay, now we continue. We are continue. Seven is saying, really don't know if they can't stop managing the person. We have said in addiction, it's a multidisciplinary thing. It's not the person who is not the person who is into him himself. So there are some people who offer guidance. There are some doctors who give. Who, yes, Mercy. I'm fine. How can I claim then I have to pay? You see, that is I don't understand. Oh, nimeona hapo kwa nini umenitumia utalipa 42,000. Uh, have you've sent the wrong message to the wrong person? Okay. Yeah, it's okay. Have you? Yes, let's talk after this. I'm in a session. Please give me an hour, then we agree on what to do. Okay. Now, you see, I'm talking to Seville. Seville, this is a multidisciplinary thing. A person cannot himself come out of it. We have seen the 12 steps. I think going to the video and going slowly, and please, please, if you don't understand anything, please ask, because the 12 steps tells us, we admit, we have gone to management criteria. I think it's important I go to management again for our brother Seville at seven. Please go through management. Management, yes, our brother Seville. You identify and remove the offending agent. One, you see, symptom treatment. This is management of a person who is addicted. Symptom treatment. After symptom treatment, patient education. Educate the patient. Now, symptom, because this is a drug which is bringing out a symptom treatment. And then the other one is patient education. Patient education. Educate the patient. Educate the patient. Treat underlying substance and disorder. You get it? And then we had another treatment option, that we had a multidisciplinary team. But that we talked about the 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 the, the 12 steps, and we said the key concept of the 12 steps is honest and acceptance, surrender to a higher power, self-awareness and accountability, making amend and repairing harm, ongoing self-reflection, service to others. Thank you so much. There are some things in 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 management of substance, and some key concepts that we have to check. And I will spin out. We will go and discuss specific addiction one by one. I think we will discuss specific addiction one by one, so that we may know how a person can come out of this addiction, because all addictions may not bring depression in the same way. I make a day whereby we will do addiction one by one. You get it? One by one. A minute, a minute, a minute. We will do addiction one by one, so that we may know. Mhm. This is, we may know how to do what, how to 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 manage each addiction. But as I say, addiction is a bad thing. And here we are dealing with drugs and of addiction and alcohol alone. We will know how to deal with all these addictions one by one. Addiction, let's say in alcohol, discipline It's a session that yes, the cost of alcoholism. Uh, we have seen how everything can go nuts, and we have brothers and sisters who are into alcohol, and we really need to help them, but we are worried how to start. This is a multi-sectoral team. We have seen how we can go and help these people in yes, Evelyn, sorry, I was on call. We can help these people and how we can control their addictions. If you have any person who is addicted, it's a good thing to know what to do and what to carry out. And we have seen how drugs disturb. I would really like again to go through uh, we go through the 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 12 rules of addiction. If a person is addicted, you get it? If a person is addicted to a substance, mhm, if a person is addicted to a substance and this person is willing, and this person is willing to change, if this person is willing to change, these are the 12 rules that you should give to this person. You should give to this person these rules for him to study them. You have a brother, you have a sister, and you have someone who is really into addiction. You please don't hate that person. Don't hate that person. Why? Because we have seen why. When serotonin and dopamine goes down, the person loses cognitive measures. The person loses cognitive. So this person may do some things that are not normal. You get it. This person may do things that are not okay. And if this person is doing things that are not okay, you should know it's because of the substance of addiction. We have gone through the substances, we have seen how they do. You talk to this person slowly, let this person be willing to change. Let this person be willing to reduce. A person may not wake up one morning and change. It's very hard for a person to wake up one morning and change. Mostly when it comes to drugs and alcohol addiction, because when you are addicted and you are overusing a drug, it changes you physically, mostly your brain, because when you're talking to drugs and alcohol, destroy the they destroy the vital organs. They destroy the vital organs like the liver, the kidney, you see, the brain is usually affected. So we talk about, you give these rules or recovery anonym to that person, like we admit we are powerless over addiction. Mhm. These are written, and when you give this person, let this person be reading them and repeating, and knowing that these are the problems that I have. Came to believe that a power greater than ourselves could restore us to sanity, made a decision to turn our will and our lives over the care of God as we understood Him, made a searching and fearless moral inventory of ourselves, admit to God, to ourselves, I've said to God or any religious thing that you believe in, because we are all religious and some believe in their own things that they believe in. So we may not judge them. So admit to God or anything that you believe in and other human beings that exact nature of our wrongs. You get it? We entirely ready to have God remove all the defects of character. Whatever you believe in, be ready to be removed. Humble, ask Him to remove our shortcomings. Yes, whatever you've hurt someone when you are addicted, you have done something when you are addicted, now you are willing to come out of addiction. Yes, humbly asked him to remove our shortcomings, made a list of all persons we had shamed, harmed, and become willing to make amendments to all of them. We have seen prominent people who are great news anchors, who are political masters. They have been addicted and now they are nowhere. They are down. You see, now you know why a person can be a great person, but because of addiction, this person loses himself. I've said because any addiction of substance and drugs, it loses your thinking capacity because of reduction of neurotransmitters. And when neurotransmitters are disturbed, a person stops becoming himself. This person starts doing things in another way. Then you start thinking, hey, this is the same person I know. It's because the neurotransmitters are depleted, others are high. When it comes to cocaine, they elevate the dopamine and then this person loses himself. He becomes someone else, exhibiting psychotic characters. And then you judge that person. And you see addiction comes because of problems. Find out what this person has. In children, we will say it's peer pressure. What kind of peer pressure are you talking about? Hmm? When you have your children at home and they are seeing you using a drug, and you find your child using the same drug one day, but you are telling this child that is wrong, and you are using it. Are you being a good parent? I'm not saying where you are using hypertensive. I've seen a family whereby a parent is using propranolol as medication for hypertension, but a child is using propranolol as a stimulant. No, no, you see, or a depressant, and this child is becoming depressed, or this child is becoming depressed or high. So what will you need to explain to your child, I'm using this drug because of medical issues that I have, but not for the other use as a depressant, or I want to be high. You get it? Why do you expose your child at an early age on what do we say? Why do you expose your child at an early age on alcohol? Why? Lifestyle, social factors. This child will excessively use because she at an early age doesn't have discipline of control. And then you are the one who will carry the burden of health. Taking this child to hospital, you'll be traumatized because of effect of drugs and you did not help. You see that? So drugs and alcohol abuse, we have said it's a multisectoral help to a person who is addicted. This person, don't call him a bad person. A person who is addicted is a person who has brain damage. And those centers of intellectual capacity, behavior, and cognitive behavior, they are depleted. So what we do is we try and help with some drugs and some therapies. And that's why we have the 12 steps of addiction recovery. Mm. If you have a person who is an addict and you may want to help and you think he needs an anonymous person that may help that person, wherever you are, email me. We try and follow up wherever you are in this world. Let's try and follow up and help that person. And we have said the 12 concepts of addictions when a person has accepted to change is one is to enhance honesty and acceptance, surrender to higher power. Higher power means whatever that person believes in terms of religion or life, he surrenders to them so that he knows I am under something that is supernatural. Self-awareness and accountability. You took the decision to change, be accountable for the change that you want. You get it? Because it's your life. Making amendments and repairing harm. Making amendments and repairing harm. Very important. Ongoing self-reflection and service to others. Very important. Yes, we have talked a lot and so about detoxification. Detoxification. What do you understand when it comes to something like to detoxify? To detoxify is to come out of something. Is a process of clearing drugs, alcohol, or other toxins from the body. Usually, the first step in addiction treatment. The first step in addiction. Medical supervision is often necessary because when you have withdrawals from alcohol, like alcohol, what will you get? You will need some drugs that are medically controlled, like diazepines, and you see some people are even you may start having a diazepine to control seizures. You get it, and opioids. You have come from alcohol addiction, and then you are getting to diazepine and opioid addiction. You get it? So it means a doctor or a professional to take care of the control of it. Yes. Now we have another thing like general steps of detoxifying and of addictive substance. Medical assessment. We have gone through it. Evaluation of substance use. You check what is the substance use, duration and dose. For how long? Has this person used a substance for years? Has this person used a substance for months? Because some substances, if you just withdraw the substance, what will happen? This person may have a breakdown. You should taper off gradually and give medical assistance. Co-occurring physical or mental education. Physical and mental education. Stabilization is the second step. Involve medication, IV fluids like electrolytes, monitor of heart rate, monitor this person always, vital signs like blood pressure, heart rate, and mental status. Because a person who is addicted, neurotransmitters are down, some higher centers are down. You see, withdrawal and management, alcohol, opioids, benzodiazepines, stimulants, cannabis. um detoxic detox settings. You see that you should take this person to centers of detoxing, outpatient centers. In Kenya, you've seen some people are being given methadone, and they become okay. Very nice. Now, I'm coming to the end of the session today, and I've talked a lot about um, drugs and substance abuse, and I think someone somewhere will be helped by this. But always, if you have a question on how to help on substance, because there are some people who don't believe that they are addicted to something, and they need help there, but they are shy to talk about addiction. Just write an email, send. Let's see how we can help that person that you think you really need to help. Because issues of life nowadays have made people to be stressed a lot about finance issues, economic issues, chronic disease issues, families and families that are not working out. You find a man in the family is always drinking. You find a man in that society is not, the woman also is not okay. They started well, but you start saying alcohol has got to the family. Always know it's not the alcohol that has got to the family. We have seen a step whereby you try to find out associated factor. It's not alcohol that has got to the family or alcohol has got to that person. Find out. the associated factor. Mm. People may think I'm drinking out my stress. Mm. I'm drinking out for pleasure to relieve my stress. It's not, addiction is not pleasure. Addiction is not fun. It means you are losing it. When you are drinking a lot and forgetting your normal duties in life, it, it means there is something underlying and you need help. Someone on the platform told me, I don't think they can stop drinking. That is not correct. A person can stop drinking, but if taken through the steps that we have said, the steps can be 1 year, 2 years, 6 months, according to severity. We have seen severity. Is it mild, moderate, or severe? So as you diagnose, we see which step do we take, so that this person can be okay. Coming out of addiction is like palliative management. Palliative care is a care that is given to terminal disease that needs a multisectoral team to help. So here is a person who is addicted to cocaine. Here is a person who is addicted to alcohol. Here is a person who is addicted to oxycodone or barbiturates. What do you do? You involve the family, doctors, nurses, all of them, plus social and religious leaders to help. Mm. But there are some families that will turn this person away, saying that this person is not a good person. This person has that ABCD. Hmm? No, don't look at that person in that way. What we usually do is a give a way of how to help. Now we have talked about some substance abuse today. Our next topic, let's see what it will be. Disruptive gender dysphoria. We will talk about our next topic will be, I think, on depression. On depression, it is the the second last. We will talk about depressive disorder due to another medical condition. Here is where we will talk about hypothyroidism, mood disturbance caused directly by medical illnesses like stroke. Those people, we will talk about stroke. Our next topic, we will talk about stroke. We will talk about, so if you have a person who has got stroke, in your family, or you need to know more about stroke, our next topic, we are talking about stroke. We are talking about cancers. We have so many cancers that may come out. So we will talk about this, and we will know how cancers come out. What is a cancer, and why does a cancer don't get to be treated? Our next topic is that. We are going to talk and look about why cancers are not treated. Our next topic, a very nice topic that we are going to talk next time. And we will talk about, again, Parkinson's disease, and hypothyroidism. There are so many people who are suffering from hypothyroid disease. Now, as a way which is bringing depressive disorder due to medical disease. Now, we are going to, and then we will finish up with other specific and specified depressive disorders. And then we will have finished about depressive disorders. Now, after depressive disorders, we will go next to schizophrenia and other diseases like schizophrenia and psychotic disorders after that topic. But in the next time, we are going to talk about other diseases in relation to depressive disorders, and that's where we are coming to talk about, to introduce cancer, stroke, Parkinson's, and hypothyroidism. Now, we have talked about many things. It's about 2 hours to 30 minutes, 2 hours to 30 minutes, and questions have not come a lot today. I think people have listened to our talks today, and everything is fine. Everything is fine. So, if you have a private question about it, you may post it on. I'll give my email address in the query at the chat at yahoo.com. If you have a specific question about any addiction and how we can manage addiction on a person of substance, there are so many addictions, but here we are talking about alcohol and other substances. There is an email I've put there starting with that one. It starts with small letter Benja Okwesh at yahoo.com. If you have not subscribed, please subscribe. It enhances our morale, and share the videos. Share the videos so that we can get more listeners and we grow the platform and the society as we help other people in mental health. So next time, we have said we are introducing some diseases and how they are bringing stress to our society. We are bringing in Parkinson's, stroke, cancer, and hypothyroidism. Remember, love is my religion. Stay cool and stay blessed. Good day. Like the video and share. Remember to subscribe. Thank you.